Greetings everyone, I am Ruchi Ramani and I'm so happy to be here with you today. If you are preparing for Ontario Clinical Exam, which is OCE, don't worry. I'll explain you everything in a very simple way. My goal is to help you understand the exam and feel confident when you take it. Alright, let's get started. What is the Ontario Clinical Exam? First, let's understand what this exam is all about. The OCE is a structured interview-based exam that helps you to become a fully registered physiotherapist in Ontario. It is a clinical exam, but you don't have to show practical skills or work with real patients. Instead, you will answer questions that test how well you think like a physiotherapist. Let's talk about the structure of the exam. The exam has two parts. Part 1, the two long cases, one on assessment and one on the treatment planning. This will be for 90 minutes total. Part 2, 11 shorter vignettes. They are all going to be related to your ethics scenarios. This would be again for 90 minutes total. That's 3 hours in total and there are no scheduled breaks. But don't worry, we will help you prepare for it so that you have a smooth experience during your exam. How does OCE work? Now let's talk about how the exam happens. You will have 2 examiners who will take turns leading different parts. One will lead part 1 and the other will lead part 2. The exam is in linear format. This means you will answer the questions in order, and once you finish a question, you cannot go back. Both written and audio versions of the questions will be provided, and the information will be exactly the same in both formats. Now let's understand, what is a structured interview? A structured interview means you will be asked open-ended and closed-ended questions. The goal is to check how you apply your knowledge in different patient cases. What are the examiners listening for? Examiners are listening for clear and logical thinking, good clinical reasoning, how you make decisions as a physiotherapist. It is important to explain your answers step by step so that the examiners understand your reasoning. Understanding the exam blueprint. The blueprint is your study guide. It tells you what is included in the exam and what is not. On page 4, table 1 of the blueprint, you will see the types of patients and cases you may get, including different practice settings, body systems affected, and patient age groups. One important point. Everyone will get at least one musculoskeletal case in a rehabilitation or a private practice setting. So make sure you study musculoskeletal conditions very well. Now, how is the exam divided? The exam blueprint is based on the National Physiotherapy Advisory Group's Competency Profile 2017. It has 6 main sections or domains. On page 6, Table 3, you will see how different topics are weighted in the exam. Some topics have more questions than the others, so you should focus on the high-weighted topics first. Part 1, the case component. In Part 1, you will get 2 detailed cases. The assessment case. You will talk about how to assess a patient, form a diagnosis and suggest recommendations. Treatment case. You will explain how you would treat the patient, set goals, monitor progress, and plan the discharge. And along the line, how will you also collaborate with other disciplines? For each case, the examiner will ask a core question, and if needed, they may ask probing questions to get more details from you. Don't worry. If you get a probing question, it doesn't mean you are wrong. The examiner is just making sure that you explain everything fully. Part 2, the vignettes. In Part 2, you will see 11 short vignettes. Each vignette is just 3 or 4 hour sentences long and focuses on common physiotherapy situations, including but not limited to ethics, supervising PT assistants, confidentiality, professional behavior, and communication skills. Each vignette will have one core question and you will have 3 minutes to read the vignette before answering. Now let's understand talking to the examiners. Your examiners are trained to follow a script. This helps keep the exam fair and standard for everyone. Few important things to know. The examiner will not smile or react. Don't let this scare you. You are not keeping the process. They are just keeping the process neutral. They will not tell you if your answer is right or wrong. So just focus on giving your best response. If you need time to think, just tell them, I need a moment to think, and they will wait for you. If they interrupt you, don't panic. It just means they have heard enough and they need to move on. Best study tips. Let's talk about how to prepare effectively. Practice answering out loud. This is a spoken exam, so practice speaking clearly and logically. Find a study partner. Discuss cases together and take turns answering. Record yourself and listen back. This will help you improve your clarity and timing. Study the college standards. The vignette questions are based on the ethical guidelines. Understand every word in the blueprint. If you don't know a term, look it up before the exam. I hope now you have a clear idea of the OCE format and how to prepare. Remember, you can find all the official resources at collegept.org. And if you have any questions, don't hesitate to reach out to the team at support@pceff.com. You have got this. With the right preparation, you will do great. Stay confident and keep practicing.